Hello, my name is maliwa, and today I'm going to present to you about hospital-acquired pressure ulcers. These are pressure ulcers which develop when a patient is admitted to the hospital. The National Pressure Advisory Panel defines pressure ulcers as a localized area of tissue injury which develops when soft tissue is compressed between a bony prominence and an outside surface. An example of such areas are the heel and the tailbone. In this presentation, I will show you how pressure ulcers can increase hospital stays for the patients, increase costs, and also increase morbidity and mortality rates. According to this chart, which is a research done by Russo and Elixhauser in 2006, it shows that there were about 455,000 patients who developed pressure ulcers while they were admitted in U.S. hospitals. The highest group to be affected was the 65 to 84 age group, which had nearly 250,000 occurrences. The next group to be affected was the 85 and over. They had about 125,000 occurrences of pressure ulcers. The 45 to 64 year age group had about 100,000. And the 18 to 44 had nearly 45,000. The under 18 had the least occurrence, less than 10,000. Perhaps because younger children are usually mobile even if they're critically ill. According to a research done by Cantrell, middle-aged patients can increase their hospital stay by up to 2 weeks when they develop pressure ulcers. And according to Katz's research, it shows that nearly all the elderly patients admitted developed pressure ulcers when they were admitted to the hospital for other conditions such as pneumonia or urinary tract infections. Now, the second point we're going to discuss today is how pressure sores can increase morbidity and mortality rates for the patients. Spinal cord injury patients have a very high risk of developing pressure ulcers due to the fact that they are already immobile. These pressure ulcers can become infected and thereby worsen their illness and result in their death. Critically ill patients can develop pressure ulcers within half an hour of admission, according to Katz and others. Therefore, we should assess and provide care in a timely manner. The last point we're going to discuss is how pressure ulcers can also increase hospital costs and also increase costs for the patients. According to research, it shows that patients can increase their costs as pressure ulcers have to be paid for. Patients also increase their costs through loss of income due to extended admission to the hospital when they develop pressure ulcers. According to research done by Cantrell and others, it also shows that hospital costs for the treatment of pressure ulcers in a span of 10 years was over 13 billion, which is a very high number, considering that the Centers for Medicare have mandated that they will not pay for hospital-acquired pressure ulcers. Therefore, hospitals could lose that much compensation. Hospitals exist in order to alleviate pain and not to cause any injury to the patients. Therefore, patients should be protected from increasing their hospital stays and costs and also increasing their morbidity and mortality rates. Before we conclude this session, are there any questions from the audience?
Yes. What are the risk factors for pressure ulcer formation?
The most common risk factors for pressure ulcer formation are immobility, prolonged procedures such as very long surgeries, and also moisture.
Are hospital-acquired pressure ulcers preventable?
Unfortunately, 95% of hospital-acquired pressure ulcers are preventable if timely assessment and care is provided for the patients. If there are no more questions from the audience, this concludes my presentation. Thank you for your participation.